Hey there, Dr. Chris Cooper here with Cascade Chiropractic and Wellness. Today we're talking about headaches. Again? Yes, last time we talked about the what. Today we're going to talk about the why. We're going to talk about why these headaches happen and maybe some tips and tricks on how to treat them and maybe some tips and tricks on how to prevent them. So let's dive in. Okay, first on the list is cervicogenic headache. This is a headache that is caused by the structures in your neck. Cervico means neck, genic means it originates from, meaning this headache starts down here. So I drew a spine, excellent artist by the way, and I drew some muscles, also excellent artist. This is where the headache would come from. Key things to note with this type of headache. Your neck muscles are tight or tender, especially to the touch. Your headache is often one-sided. Your headache is brought on by certain neck movement or when held in one spot for a period of time. Your neck has a limited range of motion. Certain positions or motions can recreate similar headache pain. Certain positions or motions or lack of motion can help the headache feel a little bit better. The coolest thing about cervicogenic headaches is we treat this in our office all the time. A chiropractor is a doctor who specializes in bones and muscles. Bones and muscles is what cause these headaches. We can help this like 99% of the time. Super easy, super quick, very long-lasting relief. Fantastic stuff. All right, next category of headaches we're going to talk about are migraines. Migraines are often one-sided headaches that pulsate. They're hypersensitivity to light, hypersensitivity to sound, maybe even nausea, maybe even vomiting. These headaches are commonly caused by triggers. Trigger can be things like food, light, sound, stress, smells. Some women will get these headaches monthly just with hormone changes that cycle through the month. There are a certain category of people though that get these headaches from the top bone in their neck. Your atlas vertebra. When this bone is misaligned, sometimes you can cause tension in the neck and create a migraine headache. It's almost like a tension type headache that triggers a migraine. This type of headache we can treat in our office. If it has to do with hormones or food sensitivity or things like that, we can't treat it in our office. But you can figure out those sensitivities and avoid them to prevent these types of headaches. The next category of headaches we're going to talk about is tension type headaches. This is by far the most often headache we see in our office. Does this look familiar? The head pain starts here, goes up, lands around the ear, or maybe even behind the eye or the eyebrow. That's a tension type headache. Kind of feels like your head is in a vice. Oftentimes these headaches can be reproduced if you find, let's just say, there is a trigger point in the muscle right here. A big old knot in the muscle right back in your neck. If you find that knot and you push really hard, you can feel that pain travel up and around. The pain up in here kind of feels like deep, achy, burning vice, head in a vice pain. But I can recreate it by pushing here. And so commonly you fix this and the pain goes away. An adjustment can fix this. Trigger point therapy can fix this. Massage therapy, stretching. And then to prevent it from coming back, you have to figure out why this happened in the first place. Sometimes it's a workplace ergonomics thing. Our associate chiropractor, Dr. Sheldon Browse, is huge on ergonomics, and he's been pumping out good material with ergonomics at the workplace, healthy spine, stuff like that. Go check that out. Really good material. All right, the last type of headache we're going to talk about is a TMJ type headache. This is where the pain is originating from your temporomandibular joint or your jaw. So this headache often refers pain into the face. Sometimes people will feel like, oh, I got a toothache. And I went to my dentist and the dentist said nothing was wrong. I bet you have a TMJ type headache. This is often referred by the muscles of the jaw. You have your masseter, you have your temporalis muscle. You also have your lateral and medial pterygoids deep inside in your mouth. These can often refer pain into the teeth, into the jaw, into like this part of your face. So it's normally one-sided, but you do have two TMJ, one on either side, so it could be both sides at the same time. You're allowed to have that happen. But if it's just one-sided, that's more common. And the way to fix this is if it's an actual temporomandibular joint problem, dentist is the way to go. There's dentists that can put in appliances that pull that joint out of the socket just a little bit to relieve some of the pressure. There's ones that push your jaw forward to relieve the pressure. There's ones that prevent you from biting all the way if you're a grinder or a clencher at night. And in our office, we can treat the alignment of that joint. We can treat the muscular components, masseter, temporalis, all those other little tiny muscles, and oftentimes relieve a headache. Not too hard to fix. If you need dental stuff, we work with a lot of dentists. Refer out back and forth because this is a big one for chiropractors and dentists. Well, I hope that you enjoyed this video. It has been fun to make with Dr. Browse making the blog portion and I'm making the video portion. If you like our stuff, please subscribe, like our content below. Follow us on Facebook if you want more updates. Subscribe to us on YouTube if you want more updates. We'll keep on pumping out good content and hope to provide some value to you people. Love you. Take it easy.